This talk outlines the approach to measuring antibiotic usage and disease incidence at dairy farm level. My name is Prof McDougall. I graduated as a veterinarian from Sydney University and after some years of practice undertook a PhD at the vet school at Massey University. I've had a 30-year career in cattle medicine, production and applied on-farm research. I'm a registered specialist in cattle reproduction with the Veterinary Council of New Zealand and have an appointment as an adjunct professor at the vet school at Massey. Cognosco, the research team I lead, is in the process of completing a 3-year study into antimicrobial usage and resistance in the dairy industry here in New Zealand. The research work that underpins much of this presentation has been funded by the Sustainable Farming Fund from the Ministry for Primary Industry in New Zealand, the Dairy Cattle Veterinarians of the New Zealand Veterinary Association, and by Dairy NZ. This presentation was developed for Agriculture Victoria as part of a wider project disseminating information about antimicrobial resistance as part of the Australian National Antimicrobial Resistance Strategy. This talk outlines an approach to improving stewardship for antimicrobials on dairy farms. An important starting point is to measure current usage of antimicrobials as well as disease incidence. This data is essential, firstly to compare amongst farms to find those farms using excessive amounts of antimicrobials, but also to allow monitoring of change of drug use and disease incidence across time. In cattle production systems, farmers do much of the frontline diagnosis and treatment of endemic disease. Thus, in any discussion about prudent usage and good stewardship of antibiotics, farmers need to be directly involved. So as veterinarians, if we wish to help farmers achieve better outcomes in terms of antibiotic usage, we need a structured approach. Such an approach is built round a plan, do, review process commonly used in management and that's been used in programs such as InCalf and Countdown Down Under. The first step is to get information on drug usage on farm. This can be obtained either by sales records from veterinary clinics and/or electronic or paper records on farm. From this data, drug use can be calculated and benchmarked across farms. It's also important to understand the farmer's knowledge, attitudes, skills and aspiration around antibiotic usage. Once we have the baseline drug use data, we can then look at disease incidence and current protocols for diagnosis and treatment of specific diseases. Having collected the data and benchmark antimicrobial usage, often gaps in recording of disease or drug use are identified. Lack of clear case definitions or thresholds for treatment commencement or completion may be identified, and gaps in training of on-farm staff are often found. Based on this gap analysis, a specific plan for the farm can be developed. This may include farm-specific goals around antimicrobial usage, disease management control measures, development of standard operating procedures for specific disease diagnosis and treatment, as well as broader animal health plans. Improvements in prevention procedures such as improved biosecurity, hygiene, appropriate culling and use of vaccines may be indicated. A prerequisite for getting change in antimicrobial usage is to measure it. Antimicrobial usage may be calculated at country, industry, vet business or farm level. Lack of on-farm records often mean that these calculations are based on sales data. Such calculations often make assumptions about the animal population actually treated, including their estimated weight and class, for example, age and breed. There are different calculation methods for antimicrobial usage. These include the population corrected unit or PCU, or the animal defined daily dose or ADD based calculations. Calculations of total drug sales at national level are undertaken by many countries. For example, animal health companies are mandated to provide the Ministry for Primary Industries in New Zealand with the total mass of antimicrobials they sell each year. MPI uses this data, along with the indication for specific products, to calculate total mass of antimicrobials sold to specific industries. This approach has limitations as, for example, some products have indications for multiple species. Thus, the actual species treated can't be defined. Additionally, without knowledge of the total population of animals treated, trends across time are hard to interpret. For example, where a particular industry has grown substantially, there may be an increase in total mass of antimicrobials used by that industry, but when calculated on a mass of animal treated basis, the antimicrobial usage may have actually declined. For these reasons, calculations that take into account the mass of the animal population treated are now being used. One approach to calculation is the so-called population corrected unit, or PCU approach. This was developed in the EU and designed for country-level reporting. This calculation requires an estimate of the total population of animals in a country and estimates of the age group and likely body weight of these animals. So using a dairy herd example, we need to know how many lactating cows are present, as well as the number of calves, yearlings, and rising 2-year-olds. We also need an estimate of the body mass of each class of animal. So, for example, in a 500-cow dairy farm, we might assume that the average body weight of cows is 458 kilos, so the total mass of lactating cows on that farm is 229,000 kilograms. We then retrieve the sales data at farm level by consulting veterinary records. The antibiotics sold are then converted to the total mass of active ingredients. So a 100 ml bottle of penicillin containing 300 milligrams per ml has a total antibiotic mass of 30,000 milligrams. If a farm purchases 100 bottles of 100 ml of penicillin over a year, a total of 3 million milligrams of penicillin have been sold to that farm. To calculate antimicrobial usage, we divide the total mass of antimicrobial purchased by the total mass of cows in the population. In this example, we divide the mass of penicillin, that is 3 million milligrams, by the mass of cows, that is 229,000 kilograms, and come up with a usage of 13.1 milligram of active ingredient per population corrected unit, that is kilogram, per year. The limitations of using PCU-based calculations include having to make assumptions about the weight of the animals, as this data is rarely collected. Additionally, understanding the total population of animals at farm or at national level may be imprecise. There is also an assumption that drugs are being used in the appropriate class of animal or species. Finally, there is a question of whether a focus on reducing antimicrobial usage as calculated on a PCU basis is per se a good thing. This is because PCU takes no account of the potency of the antimicrobial. So, for example, if we look at a course of penicillin where 2 grams is injected daily for 3 days, we have a total dose of 6 grams. In contrast, the more potent ceftiofur is used as a single 3-gram dose, or enrofloxacin is used as a single 5-gram dose. In this example, if we were aiming to reduce antimicrobial usage based on PCU, the logical thing would be more of the critically important ceftiofur or enrofloxacin. This is potentially sending the wrong message, as we would actually prefer farmers to use penicillin, which is less important on the World Health Organization ranking of antimicrobials. Despite these limitations, antimicrobial usage calculated on a PCU basis has been assessed for a number of countries. For example, a recent publication by Hellerton and others in the New Zealand Veterinary Journal compared antimicrobial usage across a number of countries and found that New Zealand was the 3rd lowest user at less than 10 milligrams of antimicrobial per kilogram live weight of animal per year. In comparison, there was 40-fold higher usage in some European countries. Another calculation approach is to use the animal-defined daily dose, ADD, and then calculate the antimicrobial usage rate, or ADUR. In this approach, drug records of sales are used to calculate how many on-label daily doses of drug are used per cow per year or over some other time frame. So, for example, if an intramammary mastitis treatment is on label for 12-hourly treatment, that is 2 tubes per day, we calculate that if we sell 1 box of 20 tubes, this is equivalent to 10 animal-defined daily doses. 4 tubes of dry cow therapy are generally calculated as 1 animal-defined daily dose. For parenteral treatments, the daily dose, as defined as the on-label dose in milligrams per kilogram live weight, is multiplied by the average weight of that class of stock. Thus, if the on-label dose is 10 milligrams per kilogram and we assume the average weight of a cow is 500 kilograms, then a daily dose is 5,000 milligrams. So one 100 ml bottle of antibiotic at a concentration of 200 milligram per ml has a daily defined dose of 25 ml, and hence the bottle is 4 animal-defined daily doses. Having calculated the total number of ADD, we can divide this by the number of animals in the population. This might be on an annual basis, that is, for example, assuming that 500 cows are on a farm in 1 year. Alternatively, the calculations of the denominator can be a bit more sophisticated by accounting for the timing of culling of stock and introduction of younger stock. So returning to our example of having sold 100 bottles of penicillin, which is equivalent to 500 daily doses to a dairy herd with an average of 500 cows, then the ADUR is simply 500 ADD divided by 500 cows, or 1 ADD per cow per year. Using this approach, we analysed 1,251 herd seasons, and the ADUR was a little over 2 daily doses per cow per year. Further analysis of this ADUR by indication found that 85% of the drug usage was associated with mastitis, that is, either treatment of clinical cases or dry cow therapy. Drug usage may also be classified by the World Health Organization classification of drugs into critically important, such as fluoroquinolones, macrolides, and the 3rd and 4th generation cephalosporins, highly important, for example, 1st and 2nd generation cephalosporins and semi-synthetic penicillins, and finally, important antimicrobials such as penicillin and oxytetracycline. Using this categorization, we found that the median herd ADUR was 0.04, 0.84, and 0.33 per cow per year of the critically important, highly important, and important antimicrobials, respectively. There is a strong positive association between calculated drug usage based on PCU and ADD-based calculations. So from a practical point of view, when benchmarking herds, calculations using either approach would be useful, so long as consistently applied. Having calculated drug usage, it's also important to understand the farmer's knowledge, attitudes, skills, and aspirations around antimicrobial usage and antimicrobial resistance. This is because a lack of understanding of these factors may result in poor compliance or uptake of suggestions about changes in antimicrobial usage. To gain an understanding of farmers' knowledge, ask open-ended questions. Having gained some understanding of the farmer's KASA, then discussions about goal setting can be built around this knowledge. It is also important to understand what the incidence of disease is on a farm. Clearly, if prevalence or incidence are high, then reducing antimicrobial usage without addressing the underlying issues may result in poor welfare outcomes. Disease recording may be poor due to poor case definitions or simply lack of recorded data. Sources may include hard copy on-farm records or electronic recording systems. Often there is not consistent terminology used for disease conditions, so understanding what is meant by certain disease diagnoses is important. There may be under or over treatment due to variation in sensitivity of detection and different thresholds for intervention within and amongst farms. For example, some farmers will treat cows with a few flakes in milk as clinical mastitis, whereas others may wait 24 to 48 hours before initiating treatment, or ignore minor signs of change in milk altogether. Thus, comparisons between farms become difficult. A clear plan to reduce disease incidence and/or introducing a better case definition and treatment protocol are likely to precede any reduction in overall drug usage. So simply reducing antimicrobial usage without dealing with disease incidence may have untoward consequences. From a practical point of view, introduction of evidence-based disease management programs such as Countdown Down Under likely lead to better outcomes both in terms of disease incidence and in antimicrobial usage. In conclusion, measuring antimicrobial usage is an important prerequisite to benchmark the current position and monitor any change on farm. Due to the lack of precise on-farm treatment records, sales or purchase data may be the best basis for calculating drug usage. Calculating drug usage may be done on a population-corrected unit or animal-defined daily dose basis. The two measures are well correlated, so in practical terms it may not matter which way this is done. Drug usage needs to be assessed in the context of disease prevalence and incidence on a farm. Lack of records or poor or inconsistent case definitions of disease complicate calculations. However, it's important to understand if apparently high use of drugs is truly due to a high disease incidence or to inappropriate diagnosis and treatments. I thank you for listening to this presentation.